Hi, so we are in London at the Social Media in the Pharmaceutical Industry Conference that is holding place January 21st and 22nd. Yes, I tried to apply research that Pew Research Center had published last summer around archetypes of Twitter conversations. So Pew pointed out that there's basically 6 types that every Twitter conversation can be attributed to. And I was very intrigued by that and tried to apply that to the healthcare context. So I basically looked at several conversation types. One is definitely around medical conferences. So ASCO, we have data from 2012 to 2014, and we try to identify who is actually interacting with whom and segment that by physician, patient advocate, etc. And then we did the same with all tweets from pharmaceutical companies. So yesterday we looked at Novartis, who has one type of conversation archetype, and Boehringer, who has a bit of a different style, and that results in a different type of conversation. Well, I think I heard a lot about the usual pharmaceutical hurdles to social media. I think there's more and more appetite, but maybe not really an understanding of how to go about it, especially much more from an internal organizational and cultural perspective than actually a technical one. So as a pharmaceutical company, to try to engage technically is very easy. All the tools are there, and you have tons of great agencies who can help you with that. But really trying to make that work within your culture and create engagement and a social strategy, as well as have the governance and compliance structures in place to do this within the legal context of a pharmaceutical company are the real issues. I think it's just been, yes, I was a creator, but only in a sense that I facilitated a conversation that needed to be happening, and it was just a Skype that Andrew and I did in the middle of the summer, and we really didn't plan much, and we said let's just launch this hashtag and see who shows up, right? And we were overwhelmed by the participation and interest of people, and so we started doing weekly tweet chats, etc. Those tweet chats have stopped now, but the hashtag is still very active. I just think that in general the conversation is getting bigger and bigger, so there's lots of little subunits now. I know that you guys are doing a lot of stuff in France. We're specific for the French market. I know that Angel is doing a lot for the Spanish. So I think that's healthy, and I think that's right. So it's sort of is out of the control of the initial creators or facilitators, and that makes me very happy.
Thank you very much. Perfect.
Thank you.